Have you had a checkup with your doctor? A checkup is when you see your doctor and you are not sick. The doctor does an examination and will ask you how you feel. The purpose of a checkup is to prevent minor illnesses from becoming major or serious illnesses. Sometimes checkups are required by your insurances in the United States. These checkups will keep you healthy and sometimes give you a discount. Doctor, nurse, receptionist, medicine, treatment, stethoscope, blood pressure monitor, thermometer, clinic, checkup, prenatal care, doctor, nurse, receptionist, medicine, treatment, stethoscope, blood pressure monitor, thermometer, clinic, checkup, prenatal care. Person goes to the doctor for checkup. The doctor asks, "How are you feeling?" The person explained that he was tired and hungry a lot. The doctor asked about his diet, and the person explained that he had been eating pizza for the last 2 weeks. "I see," said the doctor. He then took his temperature with a thermometer. The patient did not have a fever. The doctor checked his blood pressure with the blood pressure monitor. "You have high blood pressure," said the doctor. After the examination, the doctor told the patient his thoughts. "You are not getting the right nutrients. That is why your blood pressure is high and you are not sleeping. You need to eat more vegetables and less pizza before you get heart disease." What was the doctor's concern? Why did he feel that way? Was it a good thing that the patient went to the doctor for a checkup? Prenatal care. If you are pregnant, you will go to many checkups before the baby is born. Usually, you will go once a month until the pregnancy is in its 9th month. Then you may go once a week. During these checkups, the doctor will ask you how you are feeling and take blood or urine samples. This process is called prenatal care. Pregnant, pregnancy, blood, urine, samples, prenatal care. Pregnant, pregnancy, blood, urine, samples, prenatal care. Why do you suspect the doctor sees the mother so frequently? What can happen if the mother does not? Medications, anemia, allergies, height, weight, tuberculosis, heart problems, cancer, high blood pressure, eye drops, penicillin, an acid, painkillers, smoking, drinking, habits. When you first see a doctor, the office staff will ask you to fill out a form with your medical history. This form lets the doctor know about your previous health or medical issues. You will also need to write down your family's previous medical history. If a family member had cancer, for example, it means that you are more likely to have cancer too. When you have big or little changes in your life that can cause stress, changes can be good, like getting a new job, or bad, like losing a job. If you worry or if you're anxious, you might have stress. Too much stress can make you unhealthy. You might be tired, not eating, or feel sad. Talk to your doctor. What are some ways to reduce or make less stress? Stress. Reduce. Meditation. Relax. support group, therapy. Medications, anemia, allergies, height, weight, tuberculosis, heart problems, cancer, high blood pressure, eye drops, penicillin, an acid, painkillers, smoking, drinking, habits, stress, reduce, meditation, relax, support group, therapy. Sometimes you may need to clarify, which means to make clear what a person said. If you do not know what they said, you can ask a question to explain. For example, did you mean at 8 in the morning? Was that a dog? Could you say that again? Did you mean the event was yesterday? Did you mean? Was that? Could you say that again? Are you saying? The following are adverbs of frequency. These are adverbs that explain how many times something happens. Never, rarely, seldom, sometimes, occasionally, often, frequently, usually, generally, always, every day, all the time. Never, rarely, seldom, sometimes, occasionally, often, frequently, usually, generally, always, every day, all the time. Things that happen never or 0% of the time, never at no time. Followed by rarely, seldom, almost never, sometimes, occasionally, often, frequently, usually, generally, almost always, and things that happen 100% of the time, always, every day, all the time.